has 4 valves. Valves are like doorways that open and close with every heartbeat to allow blood flow through and out of the heart. When valves aren't working properly, there are 2 problems that can occur. One is it can be too leaky, where blood flow is going backwards. The other problem is it can be stenotic or narrowed, which limits the blood flow through the valve and prevents blood flow to the appropriate chambers of the heart and limits blood flow to the body. TAVR stands for transcatheter aortic valve replacement. It's a minimally invasive alternative to open heart surgery, which involves inserting a catheter or small tube in through one of the arteries, usually in the groin, and inserting a device through that catheter, which takes the place of the old valve and has a new valve within it, which starts working immediately once the valve is positioned appropriately within the heart. Any patient with aortic stenosis or narrowing of the heart valve that controls the blood flow of the heart may be a candidate for the TAVR procedure. Many heart procedures, like the TAVR procedure, as well as open heart surgery, have an increased risk of stroke, which can happen when debris, such as clot or calcium, breaks off from the valve and travels to the brain. At McLeod, we use the Sentinel cerebral protection device, which is a device that can be inserted through a catheter that's advanced up the arm and deploys or position 2 baskets in the arteries leading up to the brain. This is an example of the Sentinel device, and as you can see, when we deploy one of the baskets, it will allow us to catch the debris before it reaches the arteries of the brain. After the procedure is performed, we then retract the basket, as here, and remove the catheter, removing all of the debris and significantly reducing the risk of stroke for our patients.